As anticipated, my day on my psych rotation was very short and very quick. We saw 4 patients today, and already I can feel myself like looking at them and listening to them, and I'm not always trusting everything they say, and it's not necessarily because I don't trust them. It's because a lot of these psychiatric conditions can alter your mental state, and as a result, I'm not sure how much accuracy there is in their statements. Also, some of these are pretty debilitating, like we saw a dementia patient today, and we ended up spending more time with the patient's family members than we did with the patient themselves. I find myself getting kind of caught up in like how emotional everything is and trying to listen to everything that they're saying and trying to be as sympathetic towards them as I possibly can. But what's really important, and that I noticed the psychiatrist does a really good job of, is paying attention to what you can change and the details that are pertinent to what you can actually treat and do, and then focusing and doing that, so that rather than getting lost in all of it, you're focusing on the actionable steps. That being said, he also did give quite a bit of time to the patient's family, and he says that he does that intentionally because a lot of times when the patient has a mental illness, it's not the patient that has to suffer, it's the family. It's harder for the family or the people around them than it is for the actual person. So as a result, out of sympathy for the patient and also just to help with the education, he spends a lot of time with the patient's family members and listens to them very intently, because that ultimately benefits more than anything else. We also had some pretty interesting conversation after rounding on patients, where he sat down with us and kind of gave us a little mini lecture, and he talked about the difference between competence and capacity. And then he also talks about the difference between delirium and dementia. And he said that it's really important when people call you and say, hey, this patient is anxious, you have to ask, what do you mean by anxious? Because if they're anxious, then you can give them certain medications. But if they're confused, giving them those medications that would calm them down might actually agitate them more. And those medications to be concerned about are benzodiazepines, anticholinergics, and pain meds like opioids. So definitely a quick day, but far from uneducational. Learned a lot and saw a fair amount in that short amount of time. I'm off early. I'm going to work out and then study because I have a shelf exam at the end of this month.